beauty and function go hand in hand. So if things are working well, if you're healthy, if you're like skincare, if you're getting enough sleep and you're moisturized and, then your skin looks good, right? So same with teeth. It's if everything's working well, that means you're able to chew well, you're able to be well nourished. When you smile, your teeth look good because everything's in the right position, everyone's doing their job. Yeah, so beauty and health go hand in hand. It's not separate for me.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Arezoo Nasiry, who built a strong practice with her sister and has been in the dental field for over 25 years. She's been able to thrive in an environment of DSO and insurance takeover by doing good dentistry and standing behind their work. Also, she has created ADEX Academy to teach dentists how to pass the dental board exams, which is fun and exciting because she gets to interact with new doctors entering the field. So, Dr. Ari, welcome and glad to have you here.
Thank you. Glad to be here.
So let's start from the very beginning. What got you first interested in the medical field?
I mean, when you're growing up in college, when you're 20 years old, like at least I was not one of the ones that I knew exactly what I wanted to do, but I love working with my hands and doing like detailed stuff. Like I love painting. I love doing, little knit work. So I was like, how can I take that and take it into a field? And dentistry is really all about small details, just like everything in life, but in dentistry, really like it's millimetric. So that's what I really loved. It's like detailed work.
Okay. So
Yeah.
once you realize you kind of like working with your hands, you like medicine, was
Yeah.
dentistry kind of that go-to, or did you have some other kind of fields that you can still work with your hands that you were considering, but then you end up
Um,
at the
I
ultimate?
mean, I love art, I've always painted, but as an immigrant daughter, you're not allowed to become an artist, right? You have to
Yeah.
become like a
Doctor,
doctor,
lawyer,
a
engineer.
lawyer.
Mhm.
So this was my compromise, and it turned out well.
Yeah.
No complaints. Yeah.
Okay. And so your practice, LA Dental Clinic, what led you to decide to start your own practice?
Well, I didn't start right away. I worked for about 9 years in different practices, a lot of HMO type DSO, Medicare, Medicaid. And you just get frustrated as a provider. I'm sure, like across medicine, dentistry, where you're told what you have to do, what you can do, what you can't do. And you want to do something, but you can't because the insurance doesn't cover it or there's limits. And it's like all these little games you have to play to like maximize the insurance. And that part of it just like killed me. It just kills your soul. Like you're just like every day, instead of just doing your job, you're like analyzing these insurance tables and trying to understand. And it's like I just hated it. So I decided when I start my practice, like even if I'm going broke, which I have for, starting practice was a lot of investment and not a lot of money. But at the beginning, I was like, I'm just gonna do the right thing. I'm just gonna do things the way that I know and I, think it should be done. So it's worked so far.
Okay. Well, I mean, you're here now, so it must
Yeah.
have worked. Okay. Now I want to dive a little bit deeper into the services you provide to your patients. In dentistry, there's a lot of different things. There's general dentistry, and then there's the specialties. I believe one of your specialties is in veneers.
Yes.
So let's start off with what is a veneer for people who have never heard the term or have had any use for getting a veneer. What is a veneer?
Okay, let me go back a little bit
Okay.
because, we have a body and our mouth is part of that body. And so for some reason, we have this tube, that starts in your mouth and ends in your bunghole.
Mhm.
Am I allowed to say that?
That's
I
fine.
don't know. But for some reason, insurance has decided that they're going to cover all parts of this tube except this little part. And this little part's called dental, and it's like in a whole separate category of insurance and coverage and benefits. So when we talk about veneers or dentistry in general, cost is always a huge barrier that we have to overcome. And a lot of patients, are always frustrated by what I was telling you, what's covered, what's not covered, why is this covered, why is that covered? So, when we go to veneers or when we talk about restoring someone's smile, it's really part of your body. It's really part of being a person, to have like a nice smile, to have teeth that are like fully formed, because a lot of what we do is we're basically building up teeth that are ground down or missing, and I don't consider it just beauty, because I feel like beauty and function go hand in hand, right? When something functions well, when things are in the right place and things are working, that's what we see as beautiful.
Mm,
So that's how we approach veneers in our practice. It's not just about making your teeth whiter, it's
mm.
about giving you basically your function back and making it beautiful.
Got it. Okay. And so with that in mind, like what is let's get the what is a veneer and
Right.
kind of what situation will people need or want to get a veneer?
So a lot of times, as we use our teeth or things happen, cavities, or grinding is a big issue. We start to lose parts of our teeth, right? So in a lot of the rest of our body can regrow itself. So like hair, skin, but teeth don't grow back. What happens is that teeth actually start growing out of the bone, right? So as you grind your teeth down, they still want to touch each other.
Mm,
But now that they're shorter, the lower ones have to grow up and the top ones have to grow down. So that's what starts to make your smile look a little bit not aesthetic, not cosmetic. So our job is to like put things back where they belong, add the missing tooth structure, and that's what we call beautiful.
got it. Okay. And when it comes to veneers, you do a composite layered veneer. What does
Yes.
that mean, composite layered?
So again, going back to function, so our teeth have different layers. So our teeth are like M&Ms. So on the outside, we have like a harder shell. It's called enamel. On the inside part, we have dentin, and the dentin is like the chocolate part. It's like a little bit softer. It's more flexible. And then inside that, we even have another layer, which is the nerves, right? The pulp. So when we're looking at adding the layers back, we really are thinking about those layers. So, for example, where you bite down, we want the hard shell type of material. We don't want the gooey stuff where you're grinding or where you're biting. But where we see like aesthetics, we want more translucency. So it's like a little bit softer, it's more see through. So we really layer it based on the layers of the teeth. So we try to mimic that. It's called biomimetic. We try to mimic what your teeth are actually like.
Okay. And then for Luma veneers, is that just kind of another name for the composite layer, or is that a completely different type of veneer?
Yeah, so we've kind of like tried to name it because it's just so many names like composite, bonding, veneer, da da da. So we've tried to name this system that we've created to make it into, our own thing. Like Luma veneers are layered, like what I was just telling you, biomimetic, where we're
Mhm.
trying to mimic the layers of your teeth. So wherever the function requires it to be harder, it's harder. Where it's translucent, it's translucent. We put a middle layer. We actually paint it to make it look like your natural teeth. So we're really trying to copy nature, and we're trying to kind of brand it so it's not compared to the veneers where you just cut the teeth down and put something on top.
Okay. And with this biomimetic, I haven't heard of this term before. I'm sure a lot of other people haven't heard of this term before, but
Yes.
is it kind of like what you mentioned, is you're basically trying to match it as much to the natural look as possible?
Exactly. We're trying to first of all preserve your natural teeth. So a lot of veneers, even nowadays, but certainly in the past, is all about cutting down the tooth and then putting a layer on top. So we're really trying to avoid cutting, because like what I was telling you, like the M&N analogy, if you cut that outer chocolate layer, all you're left with is like a gooey structure. And it's very hard to like have something stick on that because the underneath sublayer is actually soft, right?
Hmm.
So we want to preserve that enamel, because whatever we put on top of that is going to be much more predictable. It's going to last longer, and it's going to also look better because it's your own natural tooth.
Okay. And for this biomimetic, it can also be applied to more than just the veneers. I mean, I'm sure it can apply to
Yes.
maybe I don't know about like implants or like overlays, crowns, things along those lines.
Yes,
Is that
yes.
true?
So we have an associate in our practice, Dr. Golara, and she really specializes in everything that's not cosmetic, but in a biomimetic way. So, for example, we avoid doing full crowns. Like we try not to cut your whole tooth down. If you need part of your tooth replaced, we really just try to replace that part, build it up, like what I was telling you with the different layers. So we put something closer to the nerve, then we slowly build it up to mimic all those layers, and we really only replacing the part of your tooth that's missing or decayed or broken or something. We don't go and cut more of your tooth because that makes it easier actually when there's more cutting, you just put something on top and you're done.
Mhm.
But our whole goal is to preserve and then also copy nature as much as possible. So that's the whole point of, I guess, like our philosophy.
Okay. And you mentioned before that the function and the health needs to go hand in hand.
Yes.
So, I guess, what would you recommend to people to kind of be aware of when it comes to their dental health that can also apply to the rest of their body health wise? I mean, I think when I go to the dentist, they basically, okay, well, make sure you floss and you brush your teeth.
Right.
But like outside of that, it's like, okay, well, what else is there? So like, do you have kind of other things, like other tips, other advice that people can think about their overall health, but starting with the mouth?
Obviously you're healthy, so you don't need much, and that's what we want. We
Mhm.
want to not need much. We want to just things to work, and that's how it's supposed to be. Like our whole bodies are just, as you know, in the health and beauty, like everything is so amazing in nature. It's like self-cleansing, self-healing, and if we just like let it do its job, we shouldn't really need much. And obviously you're healthy, so you're fine, you don't need anything.
Mhm.
But when things start to break down, it's almost like a domino effect. So, for example, if you're missing a tooth, your other teeth try to compensate by drifting into that space. So the space won't stay the same size. Over the years, it'll become smaller because the other teeth will like tilt or tip, or the top tooth will come down. And then what that does is that the tooth next to it drifts and the tooth next to it drifts. Now your teeth are no longer in the position where they're supposed to be. So they start to wear down in different ways. So one side of your mouth will have like more wear, one side will have less wear, and then it kind of like keeps going like that, right? It has
Mhm.
more wear, so it wears more. Then you start to get like TMJ. It's like a domino effect. One
Mhm.
thing happens and then it just like over the years just cascades.
Mhm.
And when you're 20 and you lose a tooth, it's fine. But by the time you're 60, you have TMJ, you're grinding, your teeth are tipped, and these things just gradually happen over the years. It's not something immediate, but it's definitely like you see it over the years.
Got it. Okay. And what about on the, I guess I'll call it the mental side, like the power of having
Yes.
a nice smile or even just smiling in general? Like what can you say to that you've seen throughout your years of experience, like on the mental side, like having a nice smile and the confidence it brings?
Tell me about like all the interviews you've done about beauty and how beauty affects how we see each other. Like, what do you think since you've done so many of these interviews? How
Mhm.
does that affect us?
Yeah, in a huge way. I mean, having a nice smile and it leads to the confidence that can really turn people's lives around.
Yeah.
Mhm.
You've seen people's lives turned around by from cosmetic or beauty stuff.
Yeah, definitely.
Yeah.
Or at least from what my all my guests have said, what
Yeah,
they've
yeah.
seen
From
with
all
their
you have
patients and
you
their
have like
clients.
more knowledge on this than me. I can just tell you about the teeth part.
Mhm.
But yeah, I mean, we make a decision about how we like someone in like the first couple seconds, right?
Mhm.
Like whether it's good, bad, or ugly, we make a decision based on appearances, based on how they look, and unfortunately, we're just wired that way. So obviously having a nice smile is like one of the most amazing things. Like when you see someone with a nice smile, they're more approachable.
Mhm.
We see them as more friendly, more warm, more welcoming. And when it comes to beauty, there's been studies that we see people who are more beautiful as smarter, more
Mhm.
intelligent, like so many attributes, which is has nothing to do with their outside appearance. So it's crazy how important it is.
Yeah. Pays to be beautiful, right?
Yeah, I think so. Yeah.
Yeah. Okay. Well, Doctor, I want to talk a little bit more about the misconceptions you hear a lot from your patients. What are some of the most common misconceptions or myths that you hear from your patients about the treatment you provide or just dentistry in general?
Right. I mean, there's so many fads right now, like on social media. I was just reviewing all these like whitening fads, like strawberries, I don't know, oil pulling, and there's just like so many things. And, if something's working for you, that's fine, but it doesn't replace like actual dentistry or medicine. Like just because you eat more strawberries doesn't mean you don't have to get your teeth cleaned every 6 months, So it's fine. Like do those things as long as they're not harming you, but it doesn't replace actual medicine and actual dentistry that's provided by a professional. And I think that's a huge misconception that you can actually like do a root canal at home or something. I mean, it's crazy,
Mhm.
like,
Yeah.
so I mean, it's fine. Like I don't want to say don't do something, like do it, try it, but also please believe in the science, believe in us, because there's so much misinformation out there. Like we're here to help. Like we're not trying to make your teeth worse.
Yeah.
Yeah.
Now, when it comes to, let's say that someone is looking for I guess I'll call it more of a specialty treatment when it comes to the implant, veneers, things along those lines, not just the regular, I need my teeth cleaned. Um,
Right, right.
and let's say that they are looking for a dentist, they're not quite sure who to go to. What advice would you give to this person so they can find that dentist that they can connect with, that they trust, and who can basically get them the end results they're looking for?
I mean, nowadays it's just crazy what's out there, how much information you can get. So, like when I was growing up, you would just ask your neighbor, right? Like, who's your dentist? And then you would just go to the local dentist. And that's what I did. Like, me and all my friends, we used to go to the same guy. But now, with social media and review sites, there's so much information out there. But my biggest advice is how much time does the person spend with you, like explaining to you and talking about things that you want to do, not just like open your mouth, you need this, boom, book it.
Mm.
Unfortunately, that's the what's happening in a lot of the bigger mill type practices where it's like one patient after the other, one patient after the other. But I think you should look for someone who's going to spend the time, who's going to get to know you, and really dabble into like more deeper stuff rather than just fix the cavity. Let's look at your whole bite. Let's look at your smile. Let's think about your habits, your diet, your lifestyle. Let's look at the whole person. It's not just making a hole in a tooth. Like, let's go a little bit beyond that.
Very well said. Okay. And now, when it comes to educating your patients, like how do you approach educating your patients, particularly for things that they've never heard about, or maybe have some of those myths or misconceptions that they believe? Like I'm sure, like with the biomimetic, I'm sure you get a lot of
Right.
like, what the heck is that?
Yeah,
So,
yeah. I mean, we don't have to talk about it in those terms, but like I've just become like, instead of like a dentist, I've become like a mentalist,
mm,
where you can just read people. Like some people are just not open. Like they just want one thing fixed and that's it. And, that's fine. So when it comes to educating, I really have to see like how far does the person want to go? Like, do they want to get into all this stuff and like understand their occlusion and their habits and diet? Or is it like they just want a cleaning? They just want to get out of here?
mm,
Both are fine, but I think I can, talk for hours about something, but the person, has an appointment, has a Zoom call, has all this kind of stuff.
mm.
So I'm very flexible. And I think over the years, you get that instinct of who really wants to talk to you and who's just there to get something done and get out. So,
Got it. Now, I'm curious, what role do you believe creativity plays in how you approach your patient care? I mean, you being an artist as well, I'm curious, like, how do you see that crossover from art creativity over into the medical side, which I think most people look at it more as very structured, very protocol driven. I don't want creativity. I want you to basically do it the way it's supposed to be done.
right,
So,
right,
what role do you
exactly.
believe creativity plays?
I would call it more like experimentation than creativity. Like I would say, okay, like let's try this, like this worked better. So let's try this in the next few cases and let's see how that goes. So, I mean, for example, the layered thing, we've over the years, like we started doing just one layer. Then we're like, okay, let's add one more layer because the back layer needs to be stronger, the front layer needs to be more translucent. Then we were like, okay, let's like add a third layer because the middle layer is a little different color. And now we like paint it and we like, you just keep iterating, right? So it's not like creativity per se, but it's more just like trying things and improving on things and seeing the results and keep going. And I think that's true in any field, as you become more expert in something, you kind of go deeper into it and you add the little tweaks and all the little details that set you apart.
Got it. Okay. Now, Dr. Ari, I'm sure that over your experience, you've run across some maybe challenging cases or memorable cases you've had to work on. Is there maybe one story that comes to mind that you can share, just one of those cases, and ultimately how you were able to give them a successful outcome in the end?
Yeah, I mean, for sure. Like, starting out, we're taught there's a lot of classes for dentists on cosmetic dentistry and veneers and all this. And so we're like, okay, veneers, veneers, veneers. Like, we're doing veneers. Okay. So a person comes in, they want veneers. Boom, we give them the veneers. What happens? They come back, it's all broken. Oh my gosh, okay, we fix it. Come back, it's broken. And, from these lessons you learn, it's not just putting the thing on, right? Like, all the things I was telling you about. So habits, occlusion. So now, you learn, you're like, okay, are you grinding? Do you need a night guard? Do you need this? And it's very frustrating for the patients, when things are keep breaking or things aren't working. And, as providers, we want to do our best. We want to give you the best result. And it's frustrating for us too. So you just learn from your mistakes, like you realize maybe this bite wasn't right. They had an edge to edge bite, so their front teeth were hitting each other directly instead of the top teeth being in front. And those types of bites, it's just really hard to put a veneer on because as soon as they bite down, they're hitting right into it.
Mhm.
So yeah, I mean, frustration,
Mhm.
learning, right?
Okay. Yeah, well, that's how everyone learns, right?
Yes.
Now, Dr. Ari, where do you think the future of dentistry is going?
I've seen some robot dentists, so
Wow.
that's kind of cool.
Hmm.
There's a robot that places implants, so I like that because it's more precise. But I think our field is pretty, I guess, kind of like not AI, like AI can't come in yet, I don't think. But
Hmm.
I think, yeah, there's going to be a lot more guided stuff, right? So we can like do a 3D scan, we can plan things ahead of time digitally, and then we can use a guide to make these things. So right now, when we place implants, we pre-plan everything. So it's not like you just come in and we put an implant. We do a scan of your bone, we track where the nerve is, we check the occlusion, check your bite, check all that. So we pre-set up the case, and then when you come in, we have a guide. We know exactly where we're placing the implant. We know exactly what the crown's going to look like. So all this kind of stuff. So it's exciting.
It's going to be interesting where the future goes with it, with
Yes,
robotics and all that.
yes, yes. I think it's coming. I'm
Yeah.
not like doubting it. Yeah, I think it's coming.
Just a matter of when and
Yeah,
how exactly it'll take form. Now,
exactly.
now with the future in mind, also, like, what's the vision you have for your practice?
I mean, I just love how, you just travel through life and you kind of start out thinking one thing and as you grow, your vision changes. Like right now, we have our associate and I'm really invested in her and pouring into her and, the ADEX course, like seeing the younger generation come
Mhm.
into this field and trying to take that, when you come in and you're like, all you deal with is insurance and all this kind of stuff, you come out all negative and pessimistic.
Mhm.
So
Mhm.
trying to show them, this field is beautiful. You're changing people's lives. You're doing work that, you use your hands. Like how many people can say that these days? Everyone's sitting in front of a computer now. So it's nice to be able to like actually do something physically with your hands and produce like a physical thing that you produced with your own two hands. Like
Yeah.
it's very few jobs now that have that and it's really satisfying.
Mhm. Yeah, definitely.
Yeah.
Now, Dr. Ari, I do have one last question for you, but before I ask it, I do want to point people to your website at LA Dental Clinic. beautytalk.com.
That's right.
Last question for you. What does beauty mean to you?
I think just like what we talked about, it's like beauty and function go hand in hand. So if things are working well, if you're healthy, if you're like skincare, if you're getting enough sleep and you're moisturized and, then your skin looks good, right? So same with teeth. It's if everything's working well, that means you're able to chew well, you're able to be well nourished. When you smile, your teeth look good because everything's in the right position, everyone's doing their job. So beauty and health go hand in hand. It's not separate for me.
Okay, well, there you have it. Dr. Ari sharing her expertise. So, Dr., where can people contact you and your practice?
So just like you said, the website, you can contact us there. And if you're a new dentist and trying to pass the board exam, we have the 8X Academy too for new dentists.
Okay, awesome. Well, Dr. Ari, this is great. Thank you for coming on and thanks for sharing your knowledge.
Thank you for letting me blah, blah, blah.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.